right. So we're 5.5 decades into a humanitarian crisis in the United States, homelessness. And I'm going to talk a little bit today about how we solve homelessness. And in order to talk about that, we need to talk about how we got here. This is a woman who I met once on outreach who grew up in the same neighborhood I live in San Francisco, the Mission District. And she lived with her grandfather who died during COVID. And she was not on the lease. And so she was kicked to the curb. And that wasn't the worst of it. She also had leukemia. And at this moment, you can see in this picture, the city is doing an operation to take all her belongings. They managed to throw away her leukemia medicine, her clothing. You can't tell, but it's raining here. And in this next slide, you could see her sitting in a friend's tent, telling me her story and sobbing. And so she's experiencing the worst moment of her life, obviously. And in this middle of the struggle, the city, instead of giving her the support she needs, is really effectively kicking her when she's down. Right now, in fact, in the United States, the Supreme Court is considering whether or not it's okay to cite and arrest people who literally have no other choice but to be outside. And these kind of operations that I talked about here cost a lot of money and actually exacerbate homelessness. She lost her paperwork, which put her behind on trying to get housing. Of course, it negatively impacted her health with the loss of medication and really had the opposite impact in terms of if we're trying to address homelessness. So how did we get to this place where this woman was so scapegoated? And what's happened is that the federal and state government really has failed to address the huge disparity that delta that folks face between their income and what their cost of housing is. And it's been kind of left at the feet of local government, who in turn, without the tax base, uses police to manage the problem and kind of push people around. And in order to do that, have scapegoated homeless people and blame them for their status as opposed to these systemic causes. So how did we get here? You can kind of think about homelessness as a tale of two acts. The first act, of course, was the Great Depression, where we had over 1 million folks in the United States experiencing homelessness. And we did a lot of things in the United States structurally from a policy perspective to create that. We invested in housing, we invested in jobs, and in fact, in 1937, passed a Housing Act that basically guaranteed housing for all people in the United States. And when you fast forward here to 1983, we stepped back away from that. We cut our housing by 76%. And suddenly in 1983, we had at one time about 300,000 people, elders, children, adults, experiencing homelessness. And over the course of the year, that was probably around 700,000. In 1998, we actually withdrew that act and passed a new act that said we can't possibly provide housing for everyone in the United States. So fast forward to 2024, we have a situation in the United States where we've completely abandoned our commitment to this fundamental human right. And we have over 600,000 people experiencing homelessness, on any one night, about 1.4 million over the course of a year. Homelessness traumatizes, it cripples, and it kills. Individuals who experience homelessness are 25 years senior their calendar years on every medical point. So me as a 50-year-old woman, I'm 57, but if I were a 50-year-old woman, I would appear medically as a 75-year-old woman. When folks enter into homelessness, there's actually very small numbers of people who enter into homelessness because of substance use issues or mental illnesses, but as they're unhoused for longer and longer, their whole medical situation deteriorates, the rates of mental health and substance use skyrocket. And it doesn't affect just kind of the stereotype in your mind. Just want to point out in San Francisco, for example, where I raised my kids, every single classroom in San Francisco has at least one homeless child. The lack of sleep, these sweeps that I mentioned, all of these increase morbidity. So homelessness is solvable, but housing is foundational. And I'm going to talk a little bit about housing first, which is an evidence-based strategy that prioritizes housing without any kind of preconditions or limits to length of living there. And so in other words, you don't have to go through a particular program in order to get into housing. You basically don't have to, let's say, for example, be sober. You don't have to meet those kind of criteria. Why? Because those create other barriers to housing. And also, without housing, it's impossible to address the other things in your life. It's impossible to address your employment needs. It's impossible to address your medical needs. How can you get well if you've got a prescription and you can't hold on to that bottle of prescription out on the street? It's impossible to address substance use issues without housing or mental health issues, because those issues get worse because of the trauma of being homeless. So I want to just look at a couple cities here as comparison. Santa Clara County, they had a bond measure in a collaboration, private-public collaboration, and they were able to house about 26,000 people in Santa Clara County and prevent about 17,000 people from becoming homeless. Denver, Colorado, they did this Housing 1000, and they got 1,000 people into housing, which was great, but they have this issue where people are kind of stuck in shelter, and they've got more people experiencing homelessness because they weren't investing on the prevention side. In order to really effectively change this issue, we need to have a federal investment that's not one time, but that's ongoing and serious. And one example of that is our investment in veterans. And so from the Obama administration, they did, and all the presidents since have kept this commitment, they invested in housing veterans. And as a result, we've been able to reduce the number of veterans by 50% in the United States using this housing first model. So you can see that if we do the right investments, we can address this issue that's seen by so many as intractable. What are the key elements that need to happen? Well, first of all is prevention. So what we mean by prevention is we're talking about short, medium, and long-term subsidies, so for housing subsidies. So let's say dad breaks an arm and he's a laborer. A little short-term subsidy so he could keep the rent going. And then once the arm's healed, he's back on his feet, he's ready to go. Let's say grandma's on a fixed income and her rent is slowly hiking up above her income. She needs a long-term subsidy, maybe for the rest of her life, so she can stay in her home. And if we can't prevent homelessness for folks, let's say it's a domestic violence situation or a fire or something like that, we want to make sure there's shelter in place so that we avoid some of the situation that I was talking about before in terms of negative impacts on health. But we also want to have housing because we want those shelter beds to turn over. We don't want folks to be stuck in housing. I mean, in shelter where they're still homeless and they still have negative health outcomes. And housing isn't as overwhelming, like sometimes people think, oh my God, that takes years, it's so expensive. It's actually more cost effective than shelter. And there's a lot of different ways to do it. We could do subsidies in the private market. We could do acquisitions where we acquire buildings like we did during the pandemic. We could really utilize our public housing stock better, and we can construct housing. And we need, once folks are in housing and they have that stability, we can then couple other services to make sure that that's successful. Jobs, medical care, treatment, etc. That's going to be a lot more effective, those efforts, if the person is in housing or the family. So we want to move beyond shelter because by itself it doesn't solve homelessness. It's much more efficient, as I said, if it's paired with housing. And another thing I just want to point out that folks don't always realize, if you overinvest in shelter, you get a short-term gain in terms of folks off the streets, but the next year you end up with a higher number of homeless people if you had instead paired that investment in shelter with housing and prevention. Why? Because the folks are stuck in shelter, those shelter beds are full, and the new people becoming homeless are stuck out on the streets, and those numbers rise. So I want to look a little bit at San Francisco's homegrown solution. And so we at the Coalition on Homelessness, in 2018 and the year before that, we got together with a lot of folks and got a ton of input and did a bunch of research and wrote an initiative that was basically a tax on corporate income starting at 50 million of 0.5%, and the money has to be used on shelter, housing, treatment, and prevention. And we got sued, and it was held up in court for a couple years, and then that money was released in 2020. And so what happened is in 2022, we had our homeless count coming out of the pandemic, and San Francisco was the only city up and down the West Coast that saw a decrease in homelessness. So you compare that to, for example, Oakland, they had a 20% increase. Portland had a 20% increase. And you can see Santa Clara had a slight increase, but only 4% because of that investment that I just mentioned. Otherwise, they would have looked like some of these other cities where they had a massive explosion in the number of people experiencing homelessness. San Diego had a 22% increase. So today, in April in 2024, Prop C, which this is an initiative that just regular people getting together and trying to make a difference. We have over 4,000 people that are in housing, over 700 new shelter beds, about 4,500 households prevented from being homeless, and we have over 400 new treatment beds. So what can you do at the local level? We created mass homelessness in this country. We can solve it. So one thing on a local level that can happen is if you have unhoused neighbors, introduce yourself. See if there's stuff that they need support with. When people don't have access to electricity or a place to, charge a phone, for example, it's really difficult. Know what services are in your neighborhood. Educate yourself. What are the services that are available or not available in your area? Speak up. Whenever there's shelter or housing going into a community, many of the community members fight back against those being put in. There's a whole bunch of people in those neighborhoods would welcome the new neighbors. We have near my house a new supportive housing program that came in, and it's so great. The new neighbors have been awesome. It's a senior program, and it's really been wonderful. And that housing wouldn't have gotten in place if neighbors didn't speak up and support it. And push your electeds, push your federal and state representatives to push for solutions that work. I want to end on a little point of inspiration and talk a little bit more about some of the things that are driving homelessness, beyond this disparity between rents and income. And homelessness is really a visual representation of oppression. In San Francisco, for example, African Americans are 5 times more likely to experience homelessness. Why? Redlining, housing discrimination, forced displacement. Latinos twice as likely. Members of the LGBTQ community make up 30%, about a third of our homeless population. They're twice as likely escaping homophobia from other places. A lot of folks have health issues. Over 60% of our population have some form of disability, facing disableism. So this here is a friend of mine, Jackie, who was one of the proponents of Proposition C that I mentioned earlier in San Francisco. And I knew her when she was unhoused, and I also knew her when she was housed. And our faces really are kind of maps of pain. You can see in people's faces all that. And I knew Jackie, and seeing her when she was unhoused and seeing her once she was in housing, and her face just completely transformed. And it was so beautiful and so inspiring. She represents a lot of folks who experience homelessness. She grew up in foster care. She was homeless as a kid. She survived just untold horrors. As a mother, having to take her children to shelter. And once she had housing, she was able to flourish as a mother. She could be just the absolute amazing mother that she is. And get a job, give back to the community, and really flourish on so many different levels. And so I just am bringing Jackie up because I find her inspiring, and I hope you find her inspiring as well. And really a testament to, she worked hard to end homelessness alongside hundreds of others in San Francisco, and is continuing to fight to end homelessness in San Francisco alongside me. And I'm hoping she inspires you all to get involved, to work together to end homelessness. Thank you.